Again, back to hearing from members of the public wishing to address the board on the closed session item and general public comment. And for members of the public on the telephone, please press 1, then 0 now to comment on these items.
Our next participant is Elizabeth Z. You may begin.
Hi, yes, I'm calling on you to reverse the recent public health order that ends mask requirements in healthcare, at least until it can be added to the agenda. This is an extremely dangerous thing to pass through, and it will kill and disable people, and we're not getting any chance to weigh in on it at all. It's really an emergency. If you care about equity and safe access to healthcare and inclusion, this is what you have to do because a lack of universal masking in healthcare forces patients to choose between essential care and preventable exposure to a virus that could disable or kill them. It asks patients to weigh the need to go to the emergency room during a possible cardiac event against the risk of a preventable COVID infection. It compels patients to assess whether a colonoscopy is worth the risk of COVID. It is profoundly unethical and dangerous. And also, there are many of the most vulnerable patients are not physically able to mask. People who have tracheectomies, people who are on supplemental oxygen, infants. Getting rid of the mask mandate is going to put everybody
Thank you very much.
Risk,
your time has
and
expired.
It is going to kill vulnerable
Thank you.
people.
Your time has expired. Next speaker, please.
Our next participant is Paul Hennessy. You may begin.
Hi, I'm calling to strongly oppose the lifting of the mask mandates in medical settings, and I urge the board to reinstate it. Medical settings need to be as safe as possible, and that requires going above and beyond with precautions. That means masking to prevent a wide variety of illnesses, not just COVID, but also flu, RSV, and rhinoviruses spread easily in hospitals, and only washing your hands is an antiquated approach. Merely masking high-risk individuals is putting the burden on the most vulnerable, and one-way masking is much less effective. Acute COVID is still a leading cause of death, and long-term effects are rising, even from mild cases. We cannot risk death, disablement, or even disruption from unnecessary infections. Hospitals need to be safe. According to the CDC, 1 in 5 infections results from long COVID. We're in the middle of a COVID surge in LA. It's ironic that you're rescinding mask mandates while one of your board members is sick. Lifting the mask mandate in medical settings will result in more cases and put unnecessary strain on the medically vulnerable and medical staff. People of LA do not want anti-masking, anti-science policies. COVID is airborne. Start acting like it.
Thank you. Next speaker, please.
Our next participant is Sarah Peters. You may begin.
Yes, I'm speaking on the August 11th decision by the Department of Public Health with the mask mandate in healthcare settings, especially given the current surge. I feel the decision was made for economic and political reasons, not what is in the best interest of public health. This is especially concerning for immunocompromised patients who either have to remove their masks for procedures or treatment who are in close contact with technicians. Ill patients shouldn't have to choose between exposure or getting needed medical care. I have a 24-year-old daughter who had COVID in January 2020. Long COVID symptoms began soon after and have become progressively worse to the point she can no longer work. There's considerable research that has been published proving that two-way masking is a highly effective way to minimize airborne COVID transmission, and healthcare workers have taken the Hippocratic oath to do no harm. Exposing high-risk and immunocompromised patients to COVID is both a moral and community failing. It's an act of eugenics. It's also been proven that more infections per person increase the likelihood of long COVID, and this mass disabling event will be a nearly insurmountable burden on our healthcare system. Please reinstate the mask mandate and impose enforcement penalties for healthcare facilities in violation.
Thank you. Next speaker, please.
Our next participant is Melissa Pinsley. You may begin.
Hi, my name is Melissa Pinsley. I've had long COVID for over a year. Please reinstate masks in healthcare facilities. I'm in UCLA's long COVID clinic, and I'm required to come into offices for routine testing and procedures. Removing masks in healthcare puts my life at risk as I cannot risk another infection, whether it's COVID or flu or RSV or TB. We know COVID is airborne and spreads via aerosols, which a well-fitting respirator mask will stop in conjunction with clean air filtration. Knowing we can prevent the spread and choosing not to is active eugenics. In May 2023, WHO said 1 in 10 COVID infections lead to long COVID. Now they are saying 1 in 5 infections, including asymptomatic people, will lead to long COVID, and your chances increase with each infection. Long COVID is terrible and mostly housebound, and some days completely bedbound, unable to move. I have 2 young kids who depend on me. Dropping masks is going to kill and disable so many more people, including our healthcare workers. And that blood will be on your hands if you don't do something now. When you minimize the real proven risks of COVID spread, you minimize my and countless other lives, including your own, because we are all at risk. Please reinstate masks in healthcare facilities. No one is safe until we are all safe.
Thank you.
Thank you.
Thank you very much. Next speaker, please.
As a final reminder for participants on the telephone, if you would like to address these items, if you have not already done so, please press 1 and then 0 now to be placed in the speaking queue. Moderator, may we have the next speaker, please?
Our next participant is TJ Choi. You may begin.
I'm calling to ask that you reinstate masking in LA County hospitals. Over the last 8 weeks, there has been a 193% increase of COVID in wastewater surveillance. And from what I can tell, Supervisor Mitchell is currently sick with COVID. I recognize that hoarse voice. One-way masking does not work, especially when it concerns immunocompromised and vulnerable people in healthcare. So it seems really, really a terrible time at this point to drop masking in the middle of a surge. And the letter that I got back from DPH Media stating, quote, "We acknowledge that COVID-19 continues to circulate in Los Angeles County, however, with relatively low rates of transmission." I don't know when this letter was written, but it was sent to me on Friday, and I feel like at best it's really uninformed. And at worst, it's a gaslighting lie. So if this is the kind of information that Public Health and Board of Supervisors is working on, I highly suggest you hire more people to keep surveillance on what is happening with COVID, because this is unbelievable. And to suggest that vulnerable people
Thank you. Your
protect
time is
themselves
expired.
in a hospital.
Thank you. Your time is expired. Next speaker, please.
Our next participant is April Dolliman. You may begin.
Hi. Yes, please keep masks in healthcare settings for medical professionals and patients. I was infected with COVID at my cardiologist's office in October of 2020. At only 31, I spent 4 days in the ICU. When I got out of the hospital, I called the office to let them know that I was infected there because I had been sheltering in place at home otherwise. They said that it was impossible and that everyone was healthy. I was hung up on. Despite wearing an N95, one-way masking is not enough, especially for vulnerable patients whose lives are just as valuable as anyone else. I'm now permanently disabled by long COVID. I couldn't even walk to the bathroom unaided for the first 7 months. I taught myself how to walk again on my own, literally crawling on the floor, because it was too unsafe for me to go in person for physical therapy. This is the reality of long COVID. It has completely destroyed my life, the life that I worked so hard for, and robbed me of the future that I've dreamt of. I have now been putting off getting more medical care to help me treat my conditions because I cannot risk reinfection, which would cause me to be more severely disabled or kill me. According to the ADA, the Americans with Disabilities
Thank you
Act.
for sharing your story. Next speaker, please.
Our next participant is Michael Olson. You may begin.
I would like to comment on mask mandates in healthcare as an epidemiologist. The lack of communication from public health agencies has left the public with an impression that the pandemic is over. It's not. COVID hospitalizations in Japan have risen from about 3,200 a day in April to about 22,000 a day today. Nosocomial COVID poses a direct threat to the lives of patients. Various peer-reviewed studies have shown that nosocomial COVID carries about a 10 to 30% mortality rate in the patient population, causing significant suffering to patients and their family and friends. We've already seen a loss of about 10,000 staffed healthcare beds around the U.S. since the start of the pandemic as a result of healthcare worker burnout, sickness, and death. A recent poll of 1,200 healthcare workers in Washington state found that 49% were likely to leave the workforce in the next 5 years. It's reasonable to assume that these results could be generalized across the country. Simple solution to part of this problem would be the implementation of respiratory protection mandates in healthcare settings, particularly requiring respirators for healthcare workers, patients and their families, healthcare workers and their families, and communities as a whole deserve no less.
Thank you. Your time is expired. Next speaker, please.
My name is Abby Mahler. I'm 29 and I've had lupus since I was 12. After a decade of symptoms, I was diagnosed in 2016, after which it took another few years of treatment to consider myself stable. But I know what it is like to lose abilities, to be the kind of sick that makes any imagined future blur. I cannot imagine seeking the care I needed then if I were seeking it now, as I can barely seek the as I can barely safely seek the needed maintenance care for my chronic illnesses. There is no justification for leaving people sicker than they were. As our own president asserts, we have the tools, but it doesn't work if you don't use them. History will look back on you in the same way we look back upon those opposed to dragging feet on other infection control practices like clean water, hand washing, and wearing gloves. Indeed, anyone actually qualified to make this decision should already have the historical perspective to know this. So why even consider it? Cost savings on PPE, costs that will skyrocket as repeat COVID infections disable 10 to 30% of those afflicted, and that likelihood is even higher for people with conditions like mine. Removing masks in healthcare renders an essential service not only inaccessible, but actively dangerous. Yes, to people like me, but to all. Employees who serve safe workspaces.
Thank you. Your time has expired.
You.
Next speaker, please.
Yes, my name is Greta Hasakis, and I am here because this is a moment filled with possibility. This is a time when mask requirements could be mandated once again, and the LA County Board of Supervisors could direct LA County Health Department to reinstate masks, keeping us safe. I am not safe in healthcare settings, as many other people have said, and so eloquently. My mother, Patricia Hasakis, was an LA County public health doctor and the director of the Binational Border Health Program. She also oversaw the mobile tuberculosis treatment for Skid Row. She handled public health emergencies. She did contact tracing and prevention and treatment. These things are not happening under LA County Health Department currently. Public health practices and protocols are not being followed. And I'm asking the LA County Board of Supervisors to please direct.
Thank you. Thank you. Next speaker, please.
I'm Sarah Johnson on behalf of 65 million to 400 million people with long COVID. I demand that LA County permanently require and enforce universal masking in all healthcare settings. Everybody in this room is either disabled or pre-disabled. Everybody is elderly or pre-elderly, and despite your age, vaccination status, past COVID infections, or how healthy or medically insured you think you are, everyone here is at risk of long COVID. It is an ADA-recognized disability with a known trigger, yet it still disables 25,000 Americans each week, adding 1.3 million per year to the existing 10 million. Long haulers are being erased from life. 65 million people on this planet have long COVID. That is equal to the entire population of France. You would see that from outer space. It's equal to all Gen Xers in the United States. If all Gen Xers in this room were disabled, who would be left? 4 million Americans are too disabled to work.
Thank you.
Losing
Thank you. Your time has expired.
$170 billion in earnings.
Thank you. Next speaker, please.
Hi, my name is Joaquin Beltran. I'm from the city of Downey and also from actioncareequity.org. My main message is to keep masks in healthcare settings. The reversal of the public health order that rescinds requirement of masking in healthcare is critical. Right now, we are in a surge. This is the worst time to implement that decision. You heard earlier today from long haulers, people going through long COVID. This is such an important issue that they came out here, even though they're struggling, to share their stories. Right now, your job here is to protect people. You are actively harming people with this public health order. I have a friend whose mother went into the hospital without COVID. She got COVID in the hospital, died from that very same infection. This is a bad, harmful health order. Please reverse it immediately. Thank you.
Next speaker, please.
There are no other speakers.
No other speakers. Okay. Then that concludes our time for public comment. Supervisor Barger, I believe you had one more amendment to your motion, to your read-in.
Yes. Excuse me. In addition to the UCLA Labor Institute, I'd like to include LANE, the LA Alliance for
a new economy.
New economy.
Great. Thank you. And so supervisors read-in motion as amended is...
Sorry, I want to submit for the record, too,
I'm sorry,
the petitions that the letters sent to your office.
Thank you. Your time has expired.
Over 6,000
Your
letters.
time has expired. We'll take
Thank you so much.
The petitions. Thank you.